All right, thanks, Raglan.
No worries. Can I just check as well that everyone can see the PowerPoint? I'm going to take silence as a yes and I'll progress, but thanks for that important reminder, Tom. And for sharing some insight, which hopefully I'll be able to delve into a little bit, because I think there's some really good news stories in the work that's being undertaken over the last 10 or so years that we can bring out and sort of share some of those stories and build on those successes. So I'll talk about the impact evaluation today that Tom and others have sort of alluded to, and give you a bit of an overview and hopefully, I guess, what that'll mean for you and how we can examine, I guess, some data that might be of particular interest to you and the teams and communities more broadly. But before I begin, I also just wanted to tell you a little bit about me. So I actually come from the Modowa clan in Papua New Guinea, so sort of the southeast tip of Papua New Guinea in Milne Bay. And then there's a couple of photos there to remind me of the warm weather that I'm missing out on at the moment as we leave a Canberra winter. And so the photo at the top right is actually a photo of my mother and some of her siblings at boarding school when she was younger. About 5, and then the reason I put that up there is actually to remind me why I do the work. So my mum is 64 or 65, depending on her actual age or a birth certificate, and I guess that can be beneficial if you want to retire early, like my mother was able to a year earlier than possibly she would have if her age was reflected accurately in her birth certificate, and also because she was able to try and get me to throw a 260th birthday party, so somewhat cheeky in that regard. But the reason I brought that up is because she is one of 8 or 9 siblings, depending on how people count, I guess, adoption processes. And she's the one of only 2 of those left. And I guess we ended up in Australia and Canberra specifically through Papua New Guinean independence in '75. And so having access to universal healthcare and access to services, to be the one or 2 of only 2 left at that sort of age is crazy. So from a social justice perspective, I guess there's a lot of room for improvement, and that's the reason why I do the work that we do. And then below that is just a photo of the wharf where my sister recently renewed her vows, the 20-year anniversary, and so there's some great fishing there, and I'd encourage people to get up there and enjoy the weather when we can. And obviously appreciate that our travel restrictions are a bit limited at the moment. So I also look forward to visiting you wherever you are when we're allowed to. So that's a little bit about me and why I ended up doing some smoking work. And I work at the Aboriginal and Torres Strait Islander Health Program and head up the tobacco stream, which includes the Tackling Indigenous Smoking evaluation. So who are we? We're led by Aboriginal and Torres Strait Islander researchers. There's about 37 staff members at the minute, including a couple of students doing both Masters of Applied Epidemiology and also PhDs. And we're also a collaboration with the Menzies School of Health Research. So David Thomas is also a co-PI on this work and also part of the TIS, the Tackling Indigenous Smoking Evaluation Executive. And I'll go into the governance a little bit in a couple of slides. But we are working with a number of organisations, including the National Best Practice Unit, Quit Victoria, and I think Glenn, I saw Glenn on the agenda, I thought, so, but I didn't see him on the Zoom at the moment, but I'm sure he'll be around. And we also work with Circa and others. And so what do? We want to know what's working to improve health and wellbeing. And so we come at our work with a strength-based approach. I sort of mentioned this before, but we have Indigenous leadership and governance, right from conception of research right through to dissemination and everywhere in between. Noting that the work we do doesn't necessarily start and finish, but continues in various capacities. We work on Indigenous data sovereignty principles. Our work is community driven. We work in partnership with a whole range of organisations, and I'll speak a little bit about Mayi Kuwayu, which is currently the largest longitudinal study of Aboriginal and Torres Strait Islander wellbeing. We just ticked over 10,000 participants. And so if you haven't done that, I'd encourage you to do it. And if Ben's still as efficient as he has been, he'll probably circulate a link there for people to complete. I feel like he beats me to the punch on these every now and then, so I'm trying to preempt him. So what does our governance look like? We're funded by the Department of Health, so Trudy and her team fund this work. We have Tithu Tharme, which is our governance committee, and there are representatives from across Australia on that committee, including Tom, Louise Lyons, some of you might know, and a whole range of Glenn's on there as well, actually, and a whole range of others. We also have partners that I mentioned before, and then there's a TIS evaluation executive, which includes Professor Ray Lovett, Jill Guthrie, David Thomas, Katie Thurber, and myself. And I should say Tithu Tharme is Ngunnawal language which means to share knowledge. So the idea of sharing what information we can access, and almost a repatriation process in terms of providing communities with data and input and feedback that they've already shared and provided. So one of our goals is to make this sort of work and those processes as easy and as accessible for communities as possible. And so hopefully I'll sort of talk to you a little bit about the work we're doing and the processes that we're going through at the minute to hopefully return some of that data to the teams and in ways and formats that are as useful as possible for you. So your input throughout this process would be greatly appreciated, and you'll see my contact details at the start and end of this slide, and I think they'll be available on ORIC as well. What's the evaluation trying to answer? So have smoking related outcomes improve faster in areas where there is tackling Indigenous smoking funding compared to areas without tackling Indigenous smoking funding? And I know that Tom sort of mentioned a few, I think he said old faces. I'll lean away from old faces, but some people who have been there from the start that have seen this program sort of evolve and the conversations change. So when I think back to the sort of period 2008 to 2010, when this program at the time was kicking off, it was incredibly difficult to have conversations about smoking at all. And there were people that weren't even open to the idea of receiving funding to address Indigenous smoking in medical services and other places. So the fact that we now have teams in the photo from Alice Springs semi-recently, with literally hundreds of people working in this program, is testament to the change that has taken place and the conversations that are occurring in communities. I say that because one of the really important things is that we need to remember is that the impact of the Tackling Indigenous Smoking program is going to be far broader than just smoking prevalence. So I think while smoking prevalence is one of the aims of the game, I guess, or one of our key indicators, there are a lot of other impacts and outcomes that we need to look at to understand what the Tackling Indigenous Smoking program is doing, how it's working and what impact it's having. So what does that mean? It means that we're looking at the proportion of people who are smoking, percentage of people who are smoking. We're looking at the number of people who have made quit attempts, who have quit, who have stayed quit. We're looking at behaviour change, so attempts at quitting, calls to quit line, access to NRT and other products to help people stop smoking. We're looking at smoking initiation. So one of the success stories, and I'll show this later on, is that there have been significant delays in uptake. So people aren't necessarily taking smoke, from a population perspective, people aren't necessarily taking up smoking at such a young age. And we can see those proportions shift. Secondhand smoke exposure. I know Tom talks about smoke-free homes and smoke-free workplaces. That's something else that we're looking at, as well as smoking during pregnancy, attitudes about smoking and quitting, and then also smoking status being recorded at health services. And the idea about that is to provide a comprehensive picture of the things that have changed. So why do we need to do this? I think Tom sort of spoke about the need for evidence and evidence-based policy and programs it helps to highlight the successes, and we've sort of seen some of those significant decreases in smoking prevalence, but there is some nuance to that, and I'll speak a little bit about that, including talking a little bit about remote Australia and why that's important. And I think I may as well start that conversation now, because I think one of the things that came out of Tithu Thame and the conversation about remote Australia is what are we talking about when we start to talk about remote Australia, and what are some of the challenges that are being faced. And I acknowledge that, obviously I'm talking about Victoria, talking to Victoria and Tasmania, but Barcho and others have raised with us that there are similarities in terms of access to programs and services and infrastructure. So even though Victoria, according to the ABS, might not have areas that are deemed remote, there are challenges with that infrastructure. And so how do we look at the data to better understand how people, how communities, how Indigenous siblings are accessing those programs and services to foster an environment that is smoke-free, for instance. So hopefully that makes a bit of sense. And I'm sure you'll speak up if you have any questions or anything like that, or need me to clarify anything. So at the moment we're going through and we're defining boundaries, and also looking at, we've developed a Tackling Indigenous Smoking program intensity score. And so what that's doing is looking at the types of programs that have been implemented in communities over the last 10 years, acknowledging that there have been different iterations of the program. So Tom sort of mentioned the population health approach, and then moving to a sort of an individual or more focused one-on-one cessation support, and then back to a population or health promotion approach. And so what we're doing is trying to understand what activities have occurred in community, what targets they've put in. Have they been focusing on youth and young people? Has it been about pregnancy? Has it been about smoke-free policy? So that we can identify those strengths and the changes that have taken place and have occurred over the last 10 years. And I say 10 years because that's when the program was implemented, but we're actually going back as far as we can. So generally about 2004, we have good data to look at how, once that was implemented, what changes have occurred in all of the sort of things that we've spoken about before. But again, if people have sort of questions or would like us to explore certain areas, then I'm always happy to hear about them. We are analysing existing data sets, again, to make that as easy as possible for the communities. We're looking at Mayi Kuwayu, which is the study of Aboriginal and Torres Strait Islander wellbeing that I mentioned before. And then we'll try and bring all that together to provide a comprehensive overview of the changes that have occurred. And obviously, as every evaluation does, there will be evaluation reports, publications, and community feedback. And one thing I'm particularly interested in is sort of how we provide that feedback to community in an iterative process. So as soon as those findings are available, we'd like to provide that back to teams and communities so that they can act on those accordingly, particularly given the copious amounts of paperwork we have to do to get access to ABS data and AIHW, etc. So defining boundaries and intensity. Tom sort of mentioned some of the variation across the country. So this is a couple of maps that I thought we'd share. So obviously the Aboriginal and Torres Strait Islander language map at the start. And then the next map behind that is the 57 regions plus the ACT. That was the first regional tackling smoking and healthy lifestyle program. And then this is sort of an ongoing iteration of the map at the minute. And then on the right-hand side, what we have is the intensity score that we're actually piloting at the minute. So if anyone's interested in actually working with us and piloting this, I'd be really appreciative of that. We've piloted it with a couple of teams across the country at the moment. No one from Victoria yet, but I'd be keen to test it out to see what you think and to see if it's useful. And again, this is to help us inform what sort of data we should be looking at. I guess it forms part of the data modelling development to understand what changes we would expect. Tom mentioned that there have been significant declines. Again, so these numbers sort of look from 2004-05 to 2018-19, and the most recent data that was released in December. And you can see for both males and females that there was a significant decline. When you start to unpack this, there are some differences and nuance. And again, if we think about the language map, there is incredible variation across Australia. And so we are trying to better understand that so that we can, I guess, improve and strengthen the programs and services for communities. Part of the reason I bring up the urban, regional and remote comparison is I think that this graph looks relatively, the remote smoking prevalence, I guess, is relatively stable around the 50% mark, but actually when we start to unpack it, there are some changes that have occurred over time. And so I think that those changes are really worth noting. So in urban and regional areas where the majority of Aboriginal and Torres Strait Islander smokers reside, so about 150,000 daily smokers live in urban and regional settings, and then comparison to just 49,000 daily smokers that live in remote Australia. You can see by age group that there is some significant differences. And so I guess one of the things that I wanted to point out since 2004-5 is that there have been improvements in mortality rates among the older population, so 55 plus, there have been significant declines in mortality. And so one of my hypotheses and something that we're looking into here is that because of those declines in mortality, people are actually living longer, which also includes smokers. So as a result, having older smokers living longer that are then reporting in the ABS and other data sources that they're continuing to smoke. So that's why I think you're seeing the sort of, that is one of the reasons why I think there might be some a stagnant sort of smoking prevalence among remote Australia. I think one of the other interesting things that we have to explore and look at is also access to things like education and the access to jobs and the economy in remote Australia. So there's some of the challenges that we're facing. And I think while I use the word remote Australia, according to the sort of ABS definition, there have been people, including Barcho and others, that have really stressed the importance of those access to different bits of infrastructure, including the education system and the economy, the healthcare system and so on. And I think it is important to actually recognise that there are those barriers across Australia, including places that might not necessarily be defined as remote Australia by the ABS. And so we are doing some work looking at that. As I mentioned before, we are looking at trying to get a comprehensive understanding of the program. So we are looking at national representative surveys from the ABS. We're looking at the perinatal data collection. We're looking at health service data, PBS data and quitline data, as well as some others, including Mayi Kuwayu. And what have we seen since 2004? We've seen about a 10% reduction in smoking rates. So that, what does that mean? That means that there are 50,000 fewer daily smokers than if smoking rates had remained the same. And obviously many, many lives have been saved. So that is a good news story. And so what the sort of modelling and the analysis that we're expecting to see is that as TIS is being rolled out, that we will see a change in trajectory of the smoking prevalence or smoking during pregnancy or increases in smoke-free policy. So here's sort of a simple snapshot of what we would expect to see, noting that the variation in TIS funding by region or by geographic location will vary. We are looking at Mayi Kuwayu's data, as I mentioned, and this is really using a strength-based approach. So this also looks and will give us new insight into things like the impact that racism and trauma has on tobacco use. It's also looking at protective factors, so access to country, access to traditional foods and language, things like that. So that's quite exciting. Oh, yeah, great question, Lionel. Sorry, I've seen the chat box flash away. I'll just come back. So Lionel's just, some of you may have seen, and I think this is actually where we have to be careful with data. The increase in, it's actually not an increase in the 55 plus group. It's actually not a significant change. So the lines there sort of indicate our confidence in the data. And so you can see up to 54, under 54, people aged under 54, there have been significant declines between 2004-5 and today. But actually, when it comes to the 55 plus age group, we're not confident that there is a difference. And I think part of that is because people are living longer and the mortality, less people are dying at that older age group. And so smokers are also living older at this stage. And so I've pushed up from the, say, 45, well, actually the 35 to 44 age group to 45, 54, and then 55 plus. So it's sort of a healthy cohort effect is essentially what's happening there as well. But it hasn't decreased and it hasn't increased. It's remained stagnant. It's just that we haven't been able to detect a difference at this stage. That might also have to do with some relatively small numbers and not having the population size to detect a difference at this stage. So there's some of the things we're looking into, but awesome question. Ooh, 5-minute warning. Thanks, Raquel. And if anyone else has any questions, and that's the sort of feedback actually that is really useful. So if there's things that you have questions about or would like to focus on or better understand or interpret, then let us know and we can go in and explore why there might be those differences. And some of it might be around infrastructure. So do people still have the same access to education and income and things like that, or the causes of smoking? So there's some of the things that we're trying to understand. And I am wrapping up. So we're looking at capacity building in a whole range of ways, including creating safer spaces in universities for Aboriginal and Torres Strait Islander people, returning ABS data and other data that communities have provided back to communities so that health services and TIS teams can utilise that data and improve programs and services. As I mentioned, we have about 37 staff here, predominantly Aboriginal people, and then myself. And we're disseminating our research findings as we go. So as soon as the data becomes available, we're processing it and sharing it. And so we do have ABS access data to ABS data that we're trying to get out as quickly as possible. So expect to have a couple of publications come out shortly that will provide. But also always happy to come and talk to your teams and specifically about any questions that you might have. I know there are other TIS teams that I've met with offline to go through certain bits of data or to discuss how to collect data and things like that. So always happy to do that. This might be a useful resource for you. This is a review of tobacco use among Aboriginal and Torres Strait Islander peoples and something that we published recently. I think one of the differences here is that we've tried to provide a lot of contextual information, and so we start with sort of pre-colonial discussion and talk about colonisation and the impact that colonisation has had in relation to Aboriginal and Torres Strait Islander peoples and tobacco use. So sort of unpacking that, which I think is incredibly important. So I'd encourage you, it might be useful. There's also some fact sheets and a video and a summary document that comes with that. And we're working on a podcast or something similar at the moment. So that information is going out and hopefully it'll come out in formats that are useful for people. Again, I mentioned about if there are any questions that you have, please let us know, but also if you'd like us to share data in a particular way or you'd like us to share some of that information, be it a PowerPoint or a video or a fact sheet, or artwork, then let us know and we'll try and make that as accessible as possible. And then there's my phone number. If you ever have any questions, please don't hesitate to give me a call, and my email address as well. And I'd be really keen for anyone who would like to pilot the intensity tool to help us refine that. But that's me. If anyone has any questions, let me know.
Raglan, do you prefer urban or regional settings for that trial?
I think they're all important, to be honest. So I'd be open to all of them. And we'd love to talk. We expect to speak to all teams in due course as well. So yeah, you'll be hearing from me anyway. And I think one of the benefits of that is because we do have access to about 8 national data sets, nearly all of them at the moment. Once we get that regional information, we'll be able to provide back hopefully depending on some numbers and other things, but we'll be able to provide that regional information back to you, as opposed to sometimes the data is might not be so relevant. So if I'm talking about national stuff that you might not be as interested in as you might be about Melbourne specific data or Gippsland or something like that.
Thanks for that, Raglan. Are there any more questions? Well, we've got a couple of